Welcome to Dr. XY's channel. Today we talk about why cancer can run in families. This is part 2 of our topic, why cancer is a genetic disease. And we will cover number 1, what is hereditary cancer syndrome? And number 2, what are the signs you should watch out for to recognize hereditary cancer syndrome? And here's a question. If you have several family members with breast cancer, but they're all on your father's side of the family, should you be concerned? And number 3, if you are going to undergo a genetic testing, what should you expect? Does it hurt to take the sample? How and when are you going to get your results back? So number 1, what is hereditary cancer syndrome? When we say cancer can run in families, what it means is that the gene mutation that increases one's chance to develop cancer can be passed from parents to their children. For example, in the United States, a woman's risk to develop breast or ovarian cancer by age 70 is 12 to 13%. So that's roughly a little over 1 individual per 10. And if someone inherits BCRA1 or BCRA2 gene mutation from their parents, they have hereditary breast and ovarian cancer syndrome. They have the chance of 45 to 65% to develop these cancers by age 70. So that's 5 to 6 individuals in 10. So we're not saying that hereditary cancer syndrome, meaning the patient is going to have cancer for sure, but is that the patient has a much higher risk of developing cancer compared to the general population. Number 2, what are the signs to watch out for hereditary cancer syndrome? These can be simplified into too early, too many, and too rare. So when we say too early, it means a person developed cancer at a younger age than expected for this disease. Too many has several meanings. It can be for a family, there are several cases of cancer within this family, or it can mean that cancer affects several generations of this family, from grandfather to father to son. For an individual, it means cancer that affects paired organs such as both eyes, both kidneys, and both breasts. It can also mean an individual has more than one kind of cancer. So these are the meanings of too many. A too rare means someone has a very rare type of cancer, or the family has more than one kind of rare cancer. It can also mean cancer developed in a sex that's not typically affected by this cancer. For example, breast cancer developed in a man. For patients and family who need more information, I linked below a very helpful website from the American Cancer Society. If you are concerned, by all means, you should talk to your healthcare provider to see if you should speak with a genetic counselor or a clinical geneticist. Now, let's go back to our question earlier. If you have multiple family members with breast cancer, but they're all on your father's side of the family, should you be worried? The answer is yes, because the gene mutations of BCRA1 and BCRA2 can pass down from your father's side to you or from your mother's side to you just at the same rate. So what should you expect at a genetic counseling appointment? I linked here a very helpful video provided by Dana-Farber Cancer Institute. Check it out. In short, the clinical geneticist or the genetic counselor is going to evaluate your family history based on their expertise, advise you whether or not it's necessary for you to undergo genetic testing. Number 3, what should you expect if you undergo genetic testing? Does the sampling hurt? How soon can you get your results back? And how are you going to get your results back? So DNA can be obtained from multiple sites of our body. The most classic way is getting a blood draw. If you are really worried about a needle poke, speak with your healthcare provider. There are other ways such as saliva, buccal swab. Those don't hurt at all. However, in rare occasions, we'll have to take skin biopsy. This is especially true for patients who have active blood cancer. In the first part of our video, we talked about how cancer is a buildup of gene mutations that are not inherited from our parents. So if we test for hereditary gene mutation in a sample that has other cancer-related mutations, we'll get very confusing results. Buccal swab and saliva both contain DNA from white blood cells, so they're not good for this purpose either. In these situations, we need to take skin biopsy. So how soon can you get your results back? If the sample type is blood, buccal swab, or saliva, you usually can get your results back within 2 to 3 weeks. However, if the sample type is skin biopsy, it's going to take 8 weeks or longer because the lab needs to first grow these skin biopsies for several weeks before genetic testing can start. How will your results be provided to you? It should be provided to you in the format of a clinical report and then explained to you by your clinical geneticist or genetic counselor. At a minimum, the report should contain what was tested, was there any mutation detected, and if yes, what's the interpretation of the mutation. It should also contain the limitation of the tests. This is where it explains what are the disease-relevant mutations that can potentially be missed by this test. So that is the gist of genetic testing on hereditary cancer syndromes. Do you need to know more information? If you have any question, please feel free to leave it in the comment below. And this concludes our topic, why cancer is a genetic disease. To recap, in first part of the video, we talked about how cancer is an accumulation of gene mutations that we develop throughout our lives. And number 2, which is today's video, we talked about how cancer can run in families. These are rather serious topics. However, given that millions of people are diagnosed with cancer every year, and hereditary cancer syndrome affects up to 10% of our population, I hope these videos can help someone you know, or maybe it can help you. If you appreciate today's content, share, like, and subscribe. This is Dr. XY, and I will see you next time.